address the Department of Health and Human Services issues, as well as Centers for Medicare and Medicaid reimbursement issues during a webinar. We'll discuss the best ways to ensure providers get paid for services rendered during a natural disaster, but also in the aftermath. Today, our focus topics will include the who, what, when, where, and why of a public health emergency, an overview of the Stafford Act and federal declarations, the reimbursement guidelines of the Section 1135 waiver under the Social Security Act, CMS restrictions, exceptions, and more during and after a disaster, the lowdown on timetables, extensions, geography, and state information, coding and billing resources for submitting claims after a catastrophic event, the HIPAA rules under the 1135 waiver and public health crisis, health IT basics on securing health records and systems, and how the National Disaster Medical System Definitive Care Reimbursement Program works. Also, we will offer provider information on compliance and reimbursement relief efforts in the wake of Hurricanes Harvey, Irma, Maria, Nate, and also the California wildfires. Before, during, or after natural disasters like Hurricanes Harvey, Irma, Maria, and Nate, the governor of a U.S. state or territory declares a state of emergency, and that is what starts the emergency declaration process. How the timeline works is first, a governor issues a state of emergency due to a disaster that devastates an area in a state or territory. During this time, some municipal and or state executive, judicial, and legislative services may be suspended. The state of emergency tells the federal government that the state needs additional resources to handle the incident because what they have available is just not enough at that time. Next, the President of the United States acknowledges that an emergency exists under the Stafford Act or the National Emergencies Act.